Hello and welcome. Today we're diving into a specific type of cataract called a zonular cataract. We'll explore what it is, what causes it, how it affects vision, and what can be done about it. So, what causes a zonular cataract? Unlike age-related cataracts which develop gradually over time, zonular cataracts often arise due to genetic factors, meaning they can be inherited from parents. They can also be linked to metabolic disorders during a child's development, such as galactosemia or even exposure to certain medications during pregnancy. In some cases, the exact cause remains unknown. Let's break down the how of a zonular cataract. Think of your eye's lens like a clear window that focuses light onto the retina at the back of your eye. In a zonular cataract, the opacity or cloudness forms in a specific zone or layer within the lens. This zone typically surrounds the nucleus, the central part of the lens. Because the cloudness is localized, the impact on vision depends on the size and density of the opacity. The lens is made up of fiber cells that are continuously produced throughout life. When these cells are damaged or become disorganized, they can clump together, forming the cataract. In the case of zonular cataracts, this disorganization is concentrated in a specific zone due to the aforementioned causes. Understanding how common zonular cataracts are can be tricky as exact numbers are hard to come by. They are less common than age-related cataracts. However, they are more prevalent in younger individuals, particularly children. Since many are related to genetic conditions, it's important to consider family history when assessing the risk. What are the signs and symptoms of a zonular cataract? The primary symptom is blurred vision. The degree of blurriness can vary, depending on the size and density of the cataract. Some people might experience glare or halos around lights, especially at night. In children, zonular cataracts can sometimes be detected during routine eye exams, or parents may notice a white or gray opacity in their child's pupil. If you notice any changes in your or your child's vision, it's crucial to consult an eye doctor. Diagnosing a zonular cataract involves a comprehensive eye exam. Your eye doctor will use specialized instruments, such as a slit lamp, to examine the lens and identify the characteristic zone of opacity. They will also assess your visual acuity to determine how much the cataract is affecting your vision. Other tests may be performed to rule out other eye conditions and to investigate potential underlying causes like genetic conditions. Zonular cataracts can be further classified based on their appearance and location within the lens. For instance, they can be described as lamellar, central, or peripheral, depending on the zone most affected. Some zonular cataracts may also exhibit specific shapes, such as a star-shaped cataract, which is often associated with certain genetic conditions. The treatment for zonular cataracts depends on the severity of the cataract and its impact on vision. If the cataract is small and doesn't significantly impair vision, regular monitoring may be all that's needed. However, if the cataract is causing significant visual impairment, surgery is typically recommended. Cataract surgery involves removing the cloudy lens and replacing it with an artificial lens called an intraocular lens or IOL. This is a safe and effective procedure that can significantly improve vision. In children, the timing of surgery is particularly important to prevent amblyopia, also known as lazy eye, from developing. While there's no guaranteed way to prevent zonular cataracts, especially those caused by genetic factors, minimizing exposure to risk factors can be helpful. This includes ensuring proper nutrition during pregnancy and infancy. For individuals with a family history of zonular cataracts, genetic counseling may be beneficial. The prognosis for individuals with zonular cataracts is generally good, especially with timely intervention. Cataract surgery is highly effective in restoring vision. Recent research is focused on improving the design of intraocular lenses and developing less invasive surgical techniques. Furthermore, ongoing genetic research is aimed at identifying the genes responsible for zonular cataracts, which could potentially lead to future treatments that target the underlying cause. Remember to consult with your eye doctor for personalized advice and management of zonular cataracts. Thanks for watching.